So, welcome to the Foundations of Cardiac Rehabilitation podcast series, a learning companion for students and professionals interested in evidence based cardiovascular care. My name is Kyriakos Tsitoglu, and I will be your host for this podcast series. In today's episode, we focus on a central pillar of cardiac rehabilitation, exercise prescription, not only as a physiological intervention, but as a human centered therapy. For this first podcast, entitled as the Exercise as Medicine in Cardiac Rehabilitation, I would like to welcome everyone and thank you for joining us in this first episode of our educational podcast series on cardiac rehabilitation. This series accompanies the master's program and aims to bring students together and closer to leading experts in the field. Today, we're honored to have with us Professor Evangelia Kouidi, one of the most influential Greek scientists in exercise physiology and cardiac rehabilitation. Professor, thank you so much for being here.
Well, thank you for the invitation. It's always a pleasure to discuss about exercise as a therapy, particularly in cardiac patients.
So what does exercise is medicine really mean? Let's start with a foundational concept. Medical students often hear the phrase exercise is medicine, but what does that actually mean in clinical practice?
Well, this phrase is not a metaphorical one, it's literal. Exercise does actually act as a therapy. There are several studies showing that exercise can regulate blood pressure, reduce inflammation, improve cardiorespiratory efficiency, improve the psychological status, decreasing anxiety and depression. And we can say overall that exercise, a regular exercise training, can reduce morbidity and mortality and hospitalization, especially in cardiac patients.
This is really interesting indeed. Well, students often ask, is there an ideal exercise mode for exercise rehabilitation?
Well, unfortunately, there is no universal prescription. Studies have shown that the combination of aerobic and resistance training is indeed the most effective approach. So I would recommend the combination of aerobic and resistance exercise.
Yeah, you may ask another question. So, why do you think exercise still receives less emphasis than medication in clinical practice?
Well, medication cost and it's a safe way. We know it. Medical student studies that. However, we know that exercise training is as effective as medication. So we know that it manages the hard work as effective without any cost. Exercise can improve the cardiac function, can reduce the heart rate, can increase the muscle blood flow, and increase the cardiorespiratory efficiency. That means that a safe way to for the heart to work less hard.
I see. Oh, that's great. So, let's move on to a few more questions and on what changes in physiology with training. Let's talk physiology. What actually changes inside the body of cardiac patients who starts exercising regularly?
As I already said, it reduces heart rate,
Hmm.
and that means that the heart works more economically without working so hard to do everyday living. It also improves skeletal muscle blood flow and reduces the peripheral resistance. So it does a lot, actually.
Okay, so which of these physiological adaptations you mentioned matters most for everyday life?
Definitely the improvement in VO2 peak, the aerobic capacity, as we say, or cardiorespiratory efficiency. We know that VO2 peak is an indicator of survival. So if we manage to increase VO2 peak, we earn a lot, and only exercise training can do that. So these changes are definitely the most beneficial for the patients.
I see. Well, some of patients normally have some kind of fear. So, what are patients afraid of? So, especially after a myocardial infarction, they're afraid to start exercise. So, this is understandable. What do you usually tell them to help them overcome this fear?
Well, fear is natural. After a myocardial infarction, they're afraid to start living actually. And imagine how hard it is for them to start walking, or they couldn't imagine that they can exercise. So fear is natural, but they should keep in mind that exercise is safe, that we actually have minimum or no adverse event, and they should also know that there is a uh, there is a staff and expertise with expertise that always monitor them. So if they follow a well organized cardiac rehab program, they only can earn, and they don't have any risk and they don't have to um, feel any fear.
Yeah, I see. This is really exciting, and I hope it's helpful also for patients to know. I wanted to ask if there is a patient story particularly that stayed with you, someone who overcame fear and made significant progress that will come into your mind from your experience.
Well, I have many examples, but it's rather interesting to see an old patient, well, let's say 75 years old patient with heart failure and a pacemaker, that can do almost nothing, the basic, depending on their his capacity. And it's very interesting to see him after 3 months training, how how quickly and easily can climb up the stairs and come to my lab, which is in the third floor, and uh, how happy he feels after achieving that. So uh, that's a good example, and that's a common example for the patients who participate in cardiac rehab programs.
See, that's really good. So, um, exercise prescription should be as precise as drug prescription. So, what role does cardiopulmonary exercise testing play in this process?
It's essential. Well, we always perform cardiorespiratory efficiency testing, cardiopulmonary testing before starting a cardiac rehab program, because we find out the exact capacity of the patient, and that's the way we can prescribe him um, the most suitable exercise regime for each one. So it's essential. Yeah.
I see. So again, from your experience, what mistakes do young clinicians commonly make when prescribing exercise?
Usually they increase the workload fast, rapidly, and particularly the intensity. So we need to make sure that the patient is capable to increase the workload. So monitoring is the best way to reduce that risk.
I see, and that also means that they have to take into account individualized parameters, which begs the next question. So, how individualized should exercise be? In our master's program, we emphasize personalization, but what does individualized exercise prescription really mean in practice?
So that's very important. Exercise must be individualized. That means that we need to find the most appropriate program for each patient according to his capacities, his abilities. So we need to take into account the patient's type of the disease, the comorbidities, his or her psychological status, the goals he has, what expectations he has, and his daily routine. So we need to take all these into account and prescribe the most appropriate program. After testing is very important also.
See, as you mentioned with cardiopulmonary exercise testing. So I would really like to move into some practical advice for future doctors. In your opinion, what is the practical piece of advice for a medical student who will soon meet a cardiac patient and must give basic exercise guidance?
To assess the patient, increase the workload gradually, and safety is the most important thing. Monitoring the patients and keep it safe is very important. These three things.
I see. And is there a daily habit that makes a difference for most patients?
Working for sure. So we always tell the patients to walk to increase their daily physical activity as much as they can. So walking is an easy activity that they can all do. That's my advice. Start walking.
Yeah, that's great. It's great. So beyond physiology, what do you consider the most underestimated aspect of cardiac rehabilitation?
Um, Underestimate. Um, So we need to monitor patients. We need to take it into account that exercise is a therapy and it's very important. So we need to be punctual and um, uh, listen to the exercise physiologist and the cardiologist about exercise training. That's important.
I see. So rehabilitation is about helping patients return not just to the activity, but to their lives again, isn't it?
Yeah, indeed. That's the goal of exercise training. So we ask them to participate in an exercise training program, aiming to improve their daily activity, aiming to improve their daily life. So um, it's very important to know that they're going to have benefits, and that's why they need to work hard to achieve them.
I see. This is great. And I would like to ask a question for our master students. What advice would you give to the master students preparing to work in cardiac rehabilitation?
They're lucky. They're lucky that they can help the patients. So they need to monitor the patients to assess their capacity and try to do the best, keeping in mind that it's for the best.
I see. And one message for the patients, cardiac rehab?
Keep going. It's hard but nice. When you get to the goal, you've got the most. So keep going is nice. Yeah.
This is great. So, Professor Quidi, thank you so much for this insightful discussion. You emphasized beautifully that exercise is not an optional activity. It is a powerful and session therapy. Thank you very much.
Thank you. Have a nice day.
For our listeners, stay tuned for the next episodes of this series where we will meet more experts in cardiology, exercise science and physiology, and rehabilitation.